Good morning. My name is Ted, and today I'm going to present on topic of Down syndrome. So Down syndrome is named after John Langdon Down, the British physician who described this syndrome in 1866. In this picture, it shows how human chromosomes look like in a cell. Karyotype refers to an individual's collection of chromosomes. It also means a laboratory technique that produces an image of an individual's chromosomes. It is used to look for abnormal numbers and structures of chromosomes. Down syndrome is a chromosomal disorder caused by an error in cell division resulting in the presence of an additional third chromosome 21 or trisomy 21. The problem occurs sometimes shortly after fertilization, during the phase when cells are dividing rapidly, and the process is called meiosis. And the disorder took place in the meiosis is called mosaic. There's another type of Down syndrome which is called translocation. It happens during cell division. The number 21 chromosome somehow breaks, and a piece of the number 21 chromosome then become attached to another chromosomes. Each cell still has 46 chromosomes, but the extra piece of chromosomes 21 resulting in a signs and symptoms of Down syndrome. Translocation occurs in about 3 to 4% of the cases in this disorder. The common cause of Down syndrome is due to non-disjunction, which fails to separate sister chromatids during meiosis, resulting 3 chromosomes in the 21st pair of chromosomes. That is why Down syndrome is also called trisomy 21, and there's 90 to 95% of trisomy 21 that is caused by non-disjunction. In this picture, it gives a closer look of what trisomy 21 is. As you can see, there are 3 chromosomes on the 21st pair. The pregnancy test can effectively identify any problems. Healthcare professionals were able to check for Down syndrome by using prenatal screening test and diagnostic test. Prenatal screening tests can detect a likelihood of developing the syndrome, and prenatal diagnostic tests can determine if Down syndrome exists with data. Anatomical ultrasound and serum tests are non-invasive ways of screening. Healthcare professionals will look for certain protein levels in blood tests. For example, pregnancy-associated plasma protein A and beta-human chorionic gonadotropin. If the screening shows positive results, a diagnostic test can be performed. Amniocentesis can help determine the extra chromosomes. It can be tested from 15 weeks of pregnancy. They can also do chorionic villus sampling from placenta to test the extra chromosomes. It could be performed between 11 and 13 weeks of pregnancy. What is important is that the prenatal diagnostic test can result some risk to both mothers and fetus during miscarriage. Thus, in order to test Down syndromes, screening would be the first option since it contains 2 non-invasive tools that are not harmful to mother and fetus. There is also a relationship between the chance of getting Down syndrome and mother's age. Older mothers have a higher risk of having a baby with Down syndrome. The ratio will increase larger and larger when mother is aging. Moreover, mothers who already have one child with Down syndrome can have increased risk for subsequent pregnancies. The common physical signs of symptoms on Down syndrome include decreased or poor muscle tone, short neck with excess skin at the back of the neck, flattened facial profile and nose, small head, ears, and mouth, upward slanting eyes, often with skin fold that comes out from the upper eyelid and covers the inner corner of the eye, wide, short hands with short fingers, a single deep crease across the palm of the hand, a deep groove between the first and second toes. And in addition, physical development in children with Down syndrome is often slower than development of children without Down syndrome. For example, um, because of poor muscle tone, a child with Down syndrome may be um, slow to learn how to turn over, sit, stand, and walk. Despite these delays, children with Down syndrome can learn to participate in physical exercise activities like other children. It may take children with Down syndrome longer um, than other children to reach developmental milestones, but they will eventually meet many of those milestones. There are also associated diseases with Down syndrome. Um, 40 to 60% congenital heart disease, most requiring surgery. The congenital heart disease has abnormal openings or holes in the walls that separate the heart's chambers. These result in abnormal patterns of blood flow within the heart, which leads to less oxygen that is sent into the circulation throughout the body. The most common malformation is a narrow obstruction duodenum, which is the part of the intestine into which the stomach empties duodenal atresia. People with Down syndrome may also have malfunction of GI tract. The most common malformation is a narrowed, obstructed duodenum, which is the part of the intestine into which the stomach empties. They can also develop duodenal atresia. It is the congenital absence or complete closure of a portion of the lumen of the duodenum. It causes increased level of amniotic fluid during pregnancy and intestinal obstruction in newborn babies. Moreover, the baby often vomits forcibly after feeding and cannot gain weight properly until the defect is repaired. Besides heart disease, people with Down syndrome may also have chance of developing infections, especially ear infections and pneumonia. They also have some kidney disorders and thyroid disease. Moreover, patients have 20 times greater chance of developing leukemia, which is a blood disorder, and due to poor muscle tone and hypotonia, babies born with Down syndrome need more time to learn how to sit, crawl, and walk. As people with Down syndrome age, they face an increased chance of developing the brain disease called Alzheimer's, sometimes also referred to dementia. Most people have a 6 in 100 risk of developing Alzheimer's, but people with Down syndrome have a 1 in 4 chance of getting this disease. People with Down syndrome are at increased risk for certain medical problems. Some of the problems commonly faced by people with Down syndrome, including heart defects, thyroid, muscle, or hearing problems. Other conditions seem less frequently in Down syndrome, including leukemia and seizures. People with Down syndrome are at risk for certain medical problems. Some of the problems commonly faced by people with Down syndrome, including heart defects, thyroid, muscle, and hearing problems. Other conditions seen less frequently in Down syndrome, including leukemia and seizures. However, If those problems becomes more severe, medical surgery might be required to get it fixed. Medications can be used to treat certain conditions. For example, um, if a person with Down syndrome has a seizure disorder, they would benefit from taking anti-seizure medications, or people with thyroid problems, um, then they can take thyroid replacement hormones. And people should be aware that Down syndrome cannot be cured based on medications or surgeries. Another way to treat Down syndrome is looking for physiotherapists, which focus more on motor development. Since most children with Down syndrome have hypotonia or low muscle tone, the goal of physical therapy is to teach the children with Down syndrome to move their bodies in appropriate ways and to improve their muscle tone. Working with their muscles and movements will help them reach some of their motor milestones and will prevent them from developing problems such as diabetes, bad posture, and high blood pressure. Today, the average lifespan of a person with Down syndrome is approximately 60 years. As recently as 1983, the average lifespan of a person with Down syndrome was 25 years. The dramatic increase to 60 years is largely due to the end of inhumane practice of sterilization people with Down syndrome. Most baby and young children with Down syndrome can and do attend child care centers, playgrounds, or preschool settings. Children with Down syndrome can attend mainstream schools. Many students with Down syndrome reach year 12 can go to post-school training or tertiary education to improve skills and to gain knowledge. Um, Women who have Down syndrome are able to have children, but they have 35 to 50% chance that their baby will also have Down syndrome. Some males with Down syndrome are not fertile. Um, People with Down syndrome can thrive in a wide range of positions when they have the drive, uh, support, drive, and skills they need to perform the job. Today, the average lifespan of a person with Down syndrome is approximately 60 years. Recently, as 1983, the average lifespan of a person with Down syndrome was 25 years. The dramatic increase was due to 60. The dramatic increase to 60 years is largely due to the end of inhumane practice of institutionalizing people with Down syndrome. Most baby and young children with Down syndrome can and do attend childcare centers, playgroups, and preschool settings. Children with Down syndrome can attend mainstream schools. Many students with Down syndrome reach year 12 and go on to post-school training and tertiary education to improve skills and to gain knowledge. Um, Women who have Down syndrome are able to have children. But they have 35 to 50% of chance that their baby may also have Down syndrome. Some males with Down syndrome are not fertile. People with Down syndrome can thrive in a wide range of positions when they have the support, drive, and skills they need to perform the job. While much of the work they do is part-time, ranging from 4 to 8 hours per week. Some individuals have more than one part-time job, and 3% work full-time. In the United States, uh, a recent national survey showed that 56% of people with Down syndrome who are working are in paid positions. They may be in different kinds of work, including supported employment positions in which a job coach eases the transition to a working environment. Sheltered employment in which most of the other workers also have Down syndrome, or competitive employment for they may be in different kinds of work, including supporting employment positions in which a job coach eases the transition to a working environment. Um, Sheltered employment in which most of the other workers also have Down syndrome, or competitive employment where they are only individuals with learning difficulties in their pace of work. People with Down syndrome also have shown that they can achieve and have People with Down syndrome have shown that they can achieve, and this has completely changed our understanding of their abilities. And all of these can be achieved without support from the environment, especially from family support. Family members have important role in encouraging a person with Down syndrome to show that they're capable of. If a family has high expectations of a person, better behavior and higher levels of achievement can result. On the other hand, low expectations can limit the person's potential. Um, Families are also crucial in providing leadership for the rest of the community. The attitude and expectations of the family are usually mirrored by the community at large. Families have an important role as advocates for their family members with Down syndrome. By speaking up for family members, families have been the driving force behind many of the progressive changes that have been made in the lives of people with Down syndrome and over the years. And this is my presentation. Thanks for watching.